So now that we've covered a lot of the foundational aspects, we're ready for part two. Part two here, we're going to go over some of the models of supervision I referred to earlier. Now, always keep in mind that regardless of the specific theoretical model that you choose, or the level of training or experience of a supervisee, what all the models have in common is that good supervision requires a supportive, facilitative, supervisory environment. Now, this is a necessary component for effective supervision and for supervisory growth to occur. So effective supervisory behavior, regardless of model, includes clarifying expectations and roles. As we began to talk about earlier, this comes straight from the initial contract. What do you expect from your supervisee? What can your supervisee expect from you as a supervisor? Being accessible and available, and where it's appropriate, being accessible and available beyond the supervisory hour to your supervisee, because it's your license that's on the line. To be an effective supervisor means you also have to take the role of supervisor seriously. So you're focusing on the well-being of the supervisee, you have regular and frequent appointments, being fully present in the supervisory session, and being invested in the supervisee's development. This has some corollaries to it. When we're with supervisees, and again, especially if we like them and we think they're good, it's easy to not pay attention. So if they're good and you have a lot going on as a busy professional, and you just want to check some emails real quickly in your smartphone. So while you're talking, you just whip it out and you're skimming to see if that email has come through. Or while you're talking to especially a good supervisee, phone rings and you see it's an important call you've been waiting for, easy to take it. I've known supervisors in the past who, during supervision, say, hey, listen, it's like I got a really busy day set up, and I got to get to the bank, or I have to get to the post office. Would you mind? We could just do supervision in the car. That's violating everything we just talked about. You're putting your attention elsewhere. You wouldn't dream of doing any of those things with a client, with a patient. But you may consider doing it with your supervisee. Don't. Take it seriously. Don't be distracted during the supervisory hour any more than you would be distracted during a therapeutic hour. You want to create a safe learning environment. That means setting things up where your supervisee is comfortable with telling you that they don't know what to do, with telling you that they think they might have screwed up, with telling you they're extremely worried about this patient. And when they tell you they're extremely worried about the patient, they expect that you're going to take that seriously. Not say, don't worry about it. It's a teaching moment. And you always want to be supportive and encouraging. They're newbies at it. Cut them slack. But always pay attention to what they need to learn to get better. You also want to be able to recognize and validate the strengths of your supervisee so that they know what they should continue to do, as well as what they need to change and do less of. They also need to know what they need to do more of. And also, almost by definition, our strengths are kind of invisible to us because we just assume everybody could do that. So your supervisee may be, especially because they're by definition a graduate student, They may be blissfully unaware of what they do well. That's the way our Western society is set up. For example, when was the last time a policeman stopped you and complimented you on how well you're driving? We don't do that in our society. In graduate school, we rarely tell our students how well they're doing, and they're much more, even if they got an A on one of our exams, they're much more liable to pay attention to what they got wrong. How come they didn't get an A plus? So you can provide a very valuable skill by increasing the scope of their accurate self-assessment to include an appreciation of what they do very well. You want to be able to create a relaxed learning environment. That's where learning can really take place. You want to encourage the exploration of new ideas and techniques. That gets back to the spirit of inquiry that we talked about earlier. You want to be open and flexible, and you want your supervisee to be open to new ideas and to be flexible. You want to be receptive to the feelings of your supervisee. You want to help them in their development. So we all know, as experienced psychologists, that there are weeks where just roll of the dice, we've had a lot of difficult and challenging patients. That takes its toll on us. Now, we as experienced clinicians have developed techniques on how we handle that. We know how to identify it, and we know what to do. Our poor supervisee is like brand new at this. So if we can pay attention to their feelings. Listen, I know you've had a lot of tough cases lately. How are you doing with all this? Oh, no, I'm fine. Okay, tell me how you're doing fine. Don't just accept it. Have them articulate it. And within this context, set it up where they feel comfortable enough to say, I don't know, I find myself worrying about my patients all the time, thinking about them all the time. It's like I don't leave work. You also want to be able to foster autonomy and risk-taking. Again, this sounds easy, and of course, why wouldn't I? And can be difficult. Some of you have, who are supervisors, have had the experience I know that I have, where you're sitting there, supervisee is a newbie, they bring up a very difficult and challenging aspect of a case, and you've done it several dozen times in your life. So you know exactly what to do. So you suggest that they might want to consider this and why. They go out and do it, they come back and they go, that worked great. Boy, oh boy, when I grow up, I want to be as half as good as you are. That can be very gratifying. The problem with that is you're not doing supervision to have your ego stroked. And if you fall into that trap, if you like that too much, then what can happen is your supervisee becomes dependent on you and believes they will never ever be half the psychologist you are. And they depend on you for the ideas. That's the opposite of fostering autonomy and risk-taking. With the best of intentions. So be aware. Want to perceive growth as a good supervisor as a process, and you want to be able to understand this process is ongoing. You also want to be able to work collaboratively with your supervisee. More on effective aspects of supervision. Provide constructive criticism, positive reinforcement. Constructive criticism. Our criticisms need to be done within the context of their learning. If they do something wrong, we have to be able to show them why it was wrong. Might want to get into their thinking, their decision tree, on how they came up with that. Point out the difficulties inherent in it, and point out alternatives. That's constructive criticism. And positive reinforcement, of course, of the things that they do well. You always want to model appropriate ethical behavior. You want to maintain appropriate and consistent boundaries, avoiding multiple relationships. You want to foster an idea and a goal of following competence and being credible as a psychologist. And you want to be knowledgeable and up to date. That means if you have a favorite article, well, after 20 years or 25 years, you may want to cite more recent kinds of things. Now, we've discussed that there are legal aspects to supervision. And we've also discussed that part of those legal aspects involve our licenses being on the line when we do supervision. This means that we can be sued for things that our supervisee is doing. So let's talk for a moment on ways that as supervisors we can prevent malpractice, or at least make it much less likely. So number one, establish open and trusting relationships with supervisees. Again, sounds easy, and it's easy to not. You want to maintain professional liability insurance. You want to practice only within your area of competence. Document everything carefully and thoroughly. That means taking notes after your supervision. Met with supervisee, discuss this, right? Listen to a tape. You want to consult with colleagues whenever necessary if someone has more expertise than you. And you want to keep up to date with the ever-evolving ethical standards and legal developments in the field. So we're up to models. One model of supervision has been come to be called the no-model model. Now, within the no-model model, the clinical supervisors are selected or appointed because they're really good therapists, because they're available, because they have a license, because they're an administrator, and not because they have any particular training or interest, by the way, in supervision. Their focus here is pretty much on putting out fires and diffusing severe cases, and this, by default, depends heavily on supervisees' ability to identify their own problems and willingness to ask for help with them. This supervisory approach, this model, is typified by the statement, I have an open door policy, just let me know if you have any problems. I heard about one supervisor, I hope it's not true, but I heard the story. Brand new supervisee gets assigned to them, shows up in the first week, supervisor, and it's like their second practicum ever, and the supervisor says, I'm glad you're here. Here's your list of patients, and I'm going to be on vacation for 2 weeks. Good luck. That's a no-model model. Oh, and call me if you have any problems. The difficulty with this approach is that supervisors need to be more active. They have been violating everything we've been talking about for the past hour and paying attention to none of it. They need to be more active and involved in training and monitoring their supervisees. Can't just say, come to me if you have any problems.